You're listening to Charting the Future, a podcast for independent pediatricians by PCC. For more information about our software and services, please visit www.pcc.com or visit us on social media.
Welcome back, friends. I'm here with Dr. Amaka Nnamani, one of our newest clients at PCC. And certainly, as I've said before, we're not supposed to have favorites, but she's charmed a lot of us at PCC. She's got a great origin story, and she's really busy as well, as all of my pediatric friends are. And she gracefully agreed to come on the podcast and tell us about her practice. So, Dr. Nnamani, how are you? First,
I am well. I mean, who could say no to Chip Hart, guys? So, I mean, the honor is absolutely mine. Thank you for having me.
well, a lot of people say no to me, but that's okay. I appreciate it. You're very nice. Dr. Nnamani, tell us who you are and how you became a pediatrician.
Yeah, so I am Amaka Nnamani. I'll take you all the way back to the very beginning. I was born in Houston, Texas, but I grew up in Nigeria, actually. So my formative years were in Nigeria until I was about age 16 when I moved back to the U.S. with my sister for college, med school, and everything else. I think I've always known I was going to be a pediatrician, I think since I was age 9 or 10. Really inspired by my pediatrician who in Nigeria was, I think, one of the best doctors I'd ever known. I knew I was going to be, like I said, a doctor, maybe not so sure a pediatrician. But in med school and residency, med school, believe it or not, my favorite rotation was internal medicine. So
Wow.
I had my favorite attendings were in internal medicine. And I think I decided, well, I think I might want to do internal medicine. Peds was actually one of my least favorite rotation because of the attending, quite honestly. We were in an outpatient clinic and it just wasn't the greatest experience. But then when it came time for match day, like applying for the process, okay, so I'm a very spiritual person, so this might sound a little weird. I realized I enjoyed being around children, but I did not enjoy my rotation. So I prayed and prayed and prayed. And on the day that I had to decide, I looked to the right and there was my stethoscope. And for some reason, I just realized that the whole time I had a pediatric stethoscope. And I said, okay, peds it is. That's what I'm going to apply for. And I matched with my number one, what's the word? Pick, I guess.
Yep.
And that's how I ended up being a pediatrician. Best decision ever. I would do this in my next 10 lives.
This is why I do this podcast, by the way. Your origin story right there is perfect. I mean, isn't it the best job in the world?
It truly is. I don't think it doesn't feel like a job most days. I mean, some days it does, but most days it's just, I feel like I'm living out my calling in life, and I feel truly honored to do what I do.
And by the way, I want everyone to hear, this is not someone who floats in and sees 4 patients a day and collects her $1 million paycheck. All right.
I'm getting there, hopefully.
Yeah, but like you've been busting your butt. So tell us about your new practice and how it came about.
My goodness, I don't think we have enough time for how it came about, so I'll summarize that. Mm-hmm. But I acquired this practice in January of this year after having worked in a hospital system as an outpatient pediatrician for a few years. I truly enjoyed what I did at the time, but medicine being what it is, there was just a lot of kinks, for lack of a better way to say that. And so I made a difficult decision to leave shortly after. Well, it was 2021. We had just had our 3rd child. It was the pandemic. There was a lot going on in our personal lives. And so I decided to take that leap of faith. And at that time, I actually did not have a plan, Chip, believe it or not. So we had enough saved that I think I could make that leap, and I'm truly grateful for that. But in that time, I did a lot of reflection. In that time, I wrote my book, my picture book on breastfeeding, which opened up a whole new path for me into like national and international speaking and advocacy. And I realized during that process that, oh my goodness, I really enjoyed the freedom of my own time, right? Like doing what I wanted when I wanted and not having to ask for PTO or answer to anyone about whatever. And so I decided that I was not going to work for anyone. And if I did, it would be on my terms, right? Like it wouldn't be contract. It would be like a per diem type thing. And so anyone who knows me knows I journal a lot. I've journaled since I was 10 years old. This is how I reflect, and it's therapy for me. Yep. And so I actually wrote a contract to myself and signed it. and dated that. And I believe it
Wow.
was, yeah, I did. And I said, I will not take any opportunity that was not in alignment with what I decided for myself. Um, and so it was hard though, because, the perfect opportunity hadn't come. But then one day I got an email, basically about this practice that has now become mine in rural Pennsylvania in a small city called Franklin. And I'd never heard of this place. So I literally Googled and said, is this legit? Right. And it was,
Yep.
still is.
You
And
know, I did the same thing when you told me.
did you? I know, because I was like,
Yeah.
what, Franklin? What, like
Yep.
Benjamin Franklin? Franklin? Yeah, like Benjamin. Actually, fun fact. I think this is correct. The person who assassinated, is it Benjamin Franklin? Oh my gosh,
Nope.
better be right.
Abraham Lincoln, John
Abraham
Wilkes Booth.
Lincoln. Abe
Yep.
Lincoln. See, I told you I grew up in Nigeria. Just kidding.
Yep. Yep.
Yes, it's from lived in Franklin for quite a bit from here. Fun fact about Franklin.
Okay.
So that's how I ended up here. And it's been 11 months and a half. And it's been, I think I'd say it's been the most exciting and absolutely the most challenging year of my life. I think, Chip, credit to you. You kind of prepped me. You said this would be harder than medical school. And I said, well, I've done hard things. What do you mean? I mean, I had 2 children in residency. I can do this. But man, I think this trumps that, truly.
Yep.
But having people like you and PCC and a lot of other, people in my corner has made it that much easier.
Well, I will tell you, as someone who does a lot of consulting, and you know this as a doctor, actually, you have the families who come into your office who listen to you and take your advice. And even if they're not perfect with it, you have a relationship with them where they are actually giving back to you because they
Mm.
are growing and changing and listening. And that's the same. I mean, I'm just going to tell you, that's the same with you, because from the beginning, you showed up with a piece of, with your notepad and your pen. And you're like, tell me, feed me, and you have listened. And it not just to me. I mean, you are part of, the pediatric CEO stuff, and you have a lot of peers who've sort of semi-adopted you. I think you've noticed that. And it's because you come with the right attitude, which is no ego. And it's about taking care of your patients. And those are the best type for me. Those are the best type of customers to have. Those are the best type of people to work with. And everyone is cheering for you.
Thank you. I hope they're praying for me too.
Well, yes. And one thing that also really strikes me is you didn't find a practice that's just sitting in the middle of some affluent suburb, printing money. You are bringing pediatric care to a part of the country. Where's the nearest pediatrician to your practice?
UPMC, it would be maybe 20 miles out, but it's a
Yeah.
hospital employed system.
Yep.
I do not know of any
I don't
private
count that.
practitioner.
I don't
Yeah.
count that.
I-
That's what I mean. Like you are bringing personalized, high quality, non-systemic care to a community who needs it desperately, so for me, it's like you represent the best of everything. Like not only working with you, not only does that mean we get to help you personally, but by extension, we help the thousands of kids in your community.
Mm.
It's like, that's why I say this is the world's best job. So
Thanks,
tell me
Chip.
though, you mentioned something there for a second. You wrote a book. Tell us about your book for a moment.
Book. It gives me so much joy to talk about my book.
Okay.
So it's a picture book on breastfeeding called Ziora's Quest.
Okay.
Mommy's Milk Rocks. So the name of the main character is Ziora. Ziora's actually a Nigerian name,
Okay.
credit to my roots, which
Yeah.
means teach the world.
Okay.
And the story was inspired by my own children. So at the time I wrote this book, I published this book in 2022. I was still breastfeeding my son, who was a little over a year. And my main character is actually was supposed to be my middle daughter, who was about 6 or 7 at the time. And I have to say, I pretty much co-wrote this book with my first daughter, who is now about to be 14. And I think she was about 9 or 10 at the time.
Yep.
So, like I said, the inspiration for the book came about shortly after I left my job as a full-time employed pediatrician in a hospital system. And I literally woke up one day and I said, I'm going to write a picture book on breastfeeding. And anyone who knows me knows if Amaka says something, it's crazy as it sounds, she's going to get it done one way or another. And so everyone looked at me like I lost my mind, because it's not we don't see a lot of books like that. And
Yep.
so I talked to my children, and I talked to my first daughter, first of all, and she said, and I quote, literally, this girl, I mean, on my website, you will find this information. She said, Mom, that's cool. Like, why do you want to write a picture book on breastfeeding? I said, well, because I think it's cool. Don't you think it's cool that I'm breastfeeding your brother? And in her words, she said, well, Mom, I think that's cool, but I don't think cool is a good idea to write a book. Like you can't, that just cannot be your only reason to write a book.
Yep.
And so I credit Amara with kind of leading me to my journey for my why. And so my
Yep.
why has really become my, what I call my 3 E's, which is to educate, to empower, while entertaining children and adults on the importance and benefits of breastfeeding. And so while that book was born just because I'm also a nerd. Anyone that knows, I only read nonfiction though. That's a weird thing about me. But I love picture books, so I thought it would be a cool idea to read my book to my kids at bedtime. But the more people read the book, the more they spread the word, and now the book is used in different state health departments through the WIC program as an educational resource, and the dream gets bigger every day. So yeah, thanks for asking about that.
I'm that sort of thing excites me. Let me ask you, does every new mom at Franklin Pediatrics get a copy of the book?
Good question. I literally was just writing about this in my journal the other day. I would love for that to happen. I would love for the state to purchase because it costs me a lot to print the books and to have it because I have what's it called logistics company that kind of
Yep.
fulfills orders.
Yep.
So it comes at a cost to me. So I end up losing money some of the time.
Yep.
But yeah, that is my goal is to have this for every new mom. But that's a great idea. I think until we kind of figure the whole thing out, I think that's a fantastic idea. One I was
Oh,
literally just considering. So yeah,
oh, let me
thanks for
know
the
how that
call out.
goes. So now let's slide into the questions that I ask all of my guests, and they evolve over time. But I'll start with what's keeping you up at night these days? What's
Hmm.
making you anxious? What's making you nervous? And it can be about anything, your personal life,
Yeah.
your being a pediatrician
Yes.
thing.
Yes. Oh, I think it's quite a few things. I'll be completely transparent here. So with the acquisition of the practice, what I didn't share earlier, and which you already know, Chip, is that the practice is located about 4 hours from where we currently live. And we haven't made the move yet and are actively working on it finally. So that's been a very big challenge for me I mean,
Yeah.
I think at this point, I'd say I'm a mostly recovered helicopter mom at this because I'm that mom who's there, the PTO, like I'm there for everything. I'm there
Yep.
I'm a room parent, I'm that, and I'm there when the kids get home. And it's been very, very difficult for me to not be there in that sense. My kids are now 13, almost 14, 11, and 5. That's definitely been one of the main things. The other thing with the practice, I think, has been just finding the right people for my vision. Because as you kind of insinuated in the beginning, this is more than just a business for me, really. My real mission is to serve the people and give the community the care that they deserve, and they truly have not gotten. Um, Almost in several years, right? And that's something that really brings so much joy to me is when the patients leave and say thank you. Like, we have never met a pediatrician like you that cares for our community. Are you sure you're going to stay? Because this community is also laden with a lot of substance abuse, a lot of trauma. So they haven't had the greatest of experiences historically. So I'd say the people, finding the people who are willing to go above and beyond what's expected of them versus just coming to work because you want a paycheck, right? For me, I really
Yep.
want people to be invested in that. And I say it goes without saying revenue, right? I have a very Medicaid heavy practice and wanting to just with no prior business education, Chip, I'm 1 year, barely a year in, realizing how much I don't know, which
Hmm.
is a lot. Every day I'm like, oh, I think I kind of understand what I'm doing. It's like, actually, you don't. There's more to learn. So if it's whether it's vaccines and knowing that my data logger needs to be changed periodically, I just found that out, or
Yep.
you know, being able to project almost accurately what my monthly revenue should be, expanding my patient panel, reducing no shows. There's a lot, right?
There's a lot. Yeah.
Um, a lot. So actually right now, because I acquired a practice that's been in existence for over 35 years and didn't really have much of a system, I've realized that really, I mean, 11 months in, unfortunately, I need to have an SOPs for everything.
Yep.
And so I think that's been my current project. But I think those are some of the things that have been keeping me up at night. It's a lot, I know, but yeah.
All right. Well, I have faith in you. Um, what are you excited about? What are you looking forward to?
Oh my gosh. A lot. I'm excited about the future of the practice. Physically, first of all, because it's a pretty old building. I'm anyone that knows me right now, I'm not wearing those bright colors, but I love bright colors.
Yep.
I'm looking, you're like,
Yeah.
yep. I'm looking forward to just we have bright colors now. We did a lot of facelifts and, the kids
You are going to
walking.
bring Nigeria to Franklin,
Yes!
Pennsylvania.
Simply stated, right? Like
Yeah.
right now we have like a boombox in the waiting room, so kids dance their way back to the back, right? So we already
Awesome.
have that in
I love that.
place. Yeah, so looking forward to just the physical upgrade of the building, but also just structural and organizational upgrades. Work looking forward to having a more standardized procedure
Hmm.
for doing things at the office, but also I'm Nigerian, so that goes without saying. Nigerians like to party. We just love to have a good time. So just looking forward to like hosting like programs for parents where so something I have actively going on is I have a running list of like a QR code that leads to a survey
Hmm.
of things we can do better and what services they'd like to offer or see offered. And the top three have been mental health. So like programs and like workshops on educating on teenage mental health. Other one has been lactation or breastfeeding support and mom support groups. And the third one has been evening workshops and just general parenting things. So excited about the possibility of doing that. And I think even starting a YouTube channel. So
Yep.
it's a lot there, but I think actually it goes without saying, excited about moving closer to the practice so I don't have to do such a crazy commute.
Mm. Okay.
Yeah.
Um, I love that you already had like, as you know, I don't give my guests much prep, but you were ready to go. You had all the answers. All right, here's my last question for you. If you
Yes.
could give advice to uh Amaka 2 years ago, what
Mm,
would it be? I mean, and I'm picking 2 years ago because you bought your practice about a year ago,
yeah.
and you were trying to figure out what to do about 2 years ago.
Yeah.
Knowing what you know now, what advice would you give yourself from 2 years ago?
Wow, that's such a good, deep question, Tip. I'd say number one, you got it. Like trust yourself, right? Like I found out so much about myself that I didn't even really know I had. Like I've been stretched. I don't think I had a choice. I've been stretched way more than I'd imagined. And I didn't like 2 years ago, Amaka, oh my gosh, would never have been like CEO. It still
Yeah.
feels weird calling myself a CEO. I hung out with a friend while we were in Dallas for CEO a couple weeks ago, and she literally sent me a voice note and she's like, Amaka, you're like a different person. You're the same person, but a different person. Like, cause she's known me since we were in residency. And she was like, you a CEO, like you're running, like you're writing checks and paying people's salaries. Cause I'm a goofball, right? And so I'm just chill. Just tell me what to do. I'll do it. That's kind of like my
Right.
thing.
Yep.
So I'd say trust yourself. You got this. I actually would have some business education. I think would have been really nice to have.
Yep.
And
Yep.
I really think this needs to be part of med school, regardless of if you decide to have a private practice or not, right? Like even if you're an employed physician, you want to know what you're worth. You want to know the numbers. And I really think that's really important. Dentists get this education. I don't know I mean, I know I didn't, right? But it's not part of the curriculum, right?
I've worked with probably 3 or 4 or 5 residency programs to do brief financial presentations,
Hmm.
and only 1 or 2 of them have ever asked me back. What ends up happening is like because I
Wow.
come in and I say, yeah, well, one of your options is to open a practice, and you know what they say? You can't open a practice, and I'm like,
Yeah.
yes, you can. Yeah, yes, you can. Hospitals don't want to
Yeah.
create independent clinicians; they want to create employees, and
100.
so. There are, however, I will say, in the last year or two, a couple of the residency programs have really started to wake up and say we need to keep this specialty viable, and you can't be viable if you don't understand the business aspect of your work. So,
100. Yeah.
yep,
Yeah. Yeah. So I definitely say that business education, people, people, people. So I'm big on relationships and people.
yep,
I really think that that's been one of my biggest assets so far has been just having good, no, not just people, there's people and then there's people, but
yeah,
good people who are in your
yep,
corner who really want to see you win, right? Like who will, I mean, just the other day I had a quick question. I showed a friend a text. And I quote, she said, girl, hell no, you're not doing that. Call me now. Right. And I was
right,
like, oh, okay. She's like, you're not doing that. It was a question about my accountant. And she was like, no, no, you're not doing it. Who's your accountant? Like, no, no, no. Right. But people who you can trust, because a lot of times you don't know what you don't know. Right. And
right.
having those people in your corner who are like, right, did you know about this? Did you know about
Yeah,
that?
Sue Cressley
Um,
actually in her plenary
Yes.
and she presented about it at
The
CEO.
foxhole.
She had her foxhole crew,
Yeah.
and Katrina Skinner talks about having your personal board of directors.
Mm.
You know, the small group of people you rely
Yeah.
on to be like,
Yeah.
just bounce ideas off of.
Yeah.
Make
Yeah.
sure you're not
I have
missing something.
I have, and I really recommend this for everyone, truly. I have a board of directors for different parts of my life. So for my spiritual life, my
Yes,
family life, my
that's there.
social, yes, yeah. So I mean, I feel like it saves you so much time because you learn from other people's mistakes and people who are willing to share those with you,
Yep,
right?
yep.
And I'd say prayer. I don't think I've prayed as much as I have this year in my entire life. And I feel like I'm almost, I banked so much prayer that I'm like, okay, I need more. But I think those would be the top things: trusting myself, business education, people, and my spiritual life. Yeah,
Okay.
and my family. Obviously, people definitely, that's family too.
Well, that's all good answers. I really appreciate that. Well, as I expected, you were an A+ guest.
Oh, are you just
So
saying
thank
that? Just kidding.
um, and before you know it, we're going to be pointing at Franklin Pediatrics as the A+ practice. I
Yay!
mean, just we
Literally, it's
want
in my
all.
journal, Chip. Believe it or not, I'm like, there will be a day when Chip's like, "Hey, you are, like how the dashboard says average. This is what the average
Yep, yep.
PCC top performers." I'm like, that's my goal, top performers. And
I
One
love
day
I
Chip's
love.
gonna shoot me an email and say,
Yeah,
"Hey, how are you doing this? You need to teach other practices how you're doing this."
I love the
That's my
fact
goal.
that my clients get triggered by being graded. It is such a it makes my job so much easier when I'm
Your
like, well,
clients are
hey,
doctors, Chip.
yes,
Come on.
yes, that if they don't get an A, they want to know why, and that makes they will pay attention when that happens. Well,
Yes.
as always, thank you.
Thank you.
I expect to hear and good things from and about you. So keep up the good work, and
Thank you.
we'll be seeing each other soon.
Yes. Thanks, Chip. This was fun.
All right, toodaloo.
Toodaloo.
Thank you for listening. More information can be found in our show notes. Production and editing by Chip Hart, Ali Squires, and Chris Forleo. Music by Challenger C. I'm Mark Herney.